Hello, it's me, Oscar from Marijuana Garden.
The story of Ignaz Semmelweis, who lived from 1818 to 1865, is honestly one of the most tragic and poignant in medical history. A tale of groundbreaking discovery, professional rejection, and, well, personal despair. Here's a summary of his heartbreaking journey. In the 1840s, Semmelweis worked at Vienna General Hospital's obstetrics clinic. There were actually two wards. Ward 1 was staffed by doctors and medical students with a mortality rate of about 10%, mostly from childbed fever or puerperal sepsis. Ward 2 was staffed by midwives, and the mortality rate there was only about 2%. Pregnant women, understandably, begged to avoid Ward 1, fearing for their lives. After his friend Jakob Kolechka died from an infection following a scalpel cut during an autopsy, Semmelweis, connected the dots. Doctors performed autopsies and then delivered babies without washing their hands, transferring what Semmelweis called cadaverous particles to mothers. In 1847, he mandated hand washing with chlorinated lime, which is, a strong disinfectant. The result was remarkable. Within just a few months, Ward 1's mortality rate plummeted to less than 1%. Despite this undeniable evidence, Semmelweis faced brutal opposition. The medical establishment, doctors felt insulted by the implication that they were in fact killing patients. At the time, germ theory, as proposed by Pasteur and Lister, was not yet accepted. Academic elites dismissed his data as merely statistical and unscientific. Some colleagues even called his ideas irrational. On a personal level, he was ridiculed, demoted, and eventually fired from Vienna General in 1849. In exile in Budapest, Semmelweis moved to Hungary, where he implemented hand washing with similar success, but sadly he remained marginalized. In 1861, he published The Etiology, Concept and Prophylaxis of Childbed Fever, a furious, emotionally charged work that, alienated his peers even further. By 1865, he was showing erratic behavior, likely because of untreated neurosyphilis, Alzheimer's, or maybe just severe depression after decades of rejection. In July 1865, Semmelweis was lured to a mental asylum. When he resisted, guards beat him, restrained him in a straitjacket, and confined him to a dark cell. He died 14 days later from a gangrenous wound, probably from his beating, ironically from the very same type of infection he had spent his life trying to prevent. So, years after his death, Pasteur's germ theory and Lister's antiseptic techniques, they confirmed that Semmelweis was right all along. Today, he's celebrated as a pioneer of infection control. The Semmelweis reflex is coined for the knee-jerk rejection of evidence contradicting dogma. In science, truth always wins, but sometimes it takes a funeral. His life reminds us that challenging established norms, even with truth, can come at a devastating personal cost.